If a person doesn't have to pay the full price of a service, will he tend to spend more than if he does?
No, because...
Will people spend more if they have to pay the full price than if they don't?
Well, if they have to pay part of the price, that is really the determinant in what kinds of services they're going to be requiring. Obviously...
So if you go into the supermarket right now and you can get everything at half price, you won't spend more?
If you have to pay part of a price on anything, you're going to be affected by your decision, by the decision of what costs are incurred. And so clearly, you know, this is such a fallacious argument because costs, obviously...
Why is it, isn't that common knowledge and logical that everybody, if a person doesn't have to pay the full price of something, then they will spend more and they will use that service more often than if they didn't?
Absolutely not. The problem we have today is that people aren't required to pay anything.
Well, let me ask you this. Then how do you explain this study by the Brookings Institute where they studied poor people spending, going to the doctor and surgical interventions before 1965, before Medicare and Medicaid, and they went to the doctor, obviously, less than people that were not poor. But after Medicare and Medicaid, it turns out that they don't go to the doctor or have surgical interventions at the same rate as other people. They go more often. So wouldn't that suggest that when you can receive a service without paying for it or without paying the full price, that you will use it more often? And isn't that precisely why healthcare spending is skyrocketing?
No, I don't know that Medicare is any different than any other insurance policy. If there is a need, and the doctors determine the kinds of needs there are for medical care, I don't go to the doctor any more than I absolutely have to. Not because I don't like doctors, but primarily because I don't see any need to do that. But obviously, if I'm sick and if I'm covered, I'm going to go. That's really what Medicare has done. A lot of people were sick and didn't go, even though they were sick because they had no coverage. So no one should imply, and I think your question implies, that people who are sick don't normally go to the hospital.
That's not what I was implying. This is what I was implying.
Let me ask you. You were saying it was the same as a grocery store getting a carton of milk.
If somebody else
that isn't at all.
Okay, but if somebody else...
No, there isn't an analogy there, and I won't accept that premise.
Okay, but if somebody else is paying for a service, will the person who is receiving the service worry about being overcharged?
That's my point. And
they won't, right?
You're so busy asking questions.
They won't, right?
Let me answer. But can I answer, and then maybe you can ask the next question. My answer is that if they are partners in payment, they are going to be sensitive regardless if it's half price or full price. If they are required to pay something, they then become part of the decision-making process. That isn't happening with a lot of insurance today with third-party payment. Third-party payment, in large measure, takes that full responsibility out of the hands of the user. So what we're suggesting is that there ought to be some balance, some level of responsibility for the patient as well as the responsibility for the insured. Now, whether it's $20 or $100 or $1,000, that relationship between services provided and cost is a decision made by the insurance company as well as the customer or the patient.
After they pay the co-payment, what does it matter to them if they're grossly overcharged or not? They don't have to pay anything extra, so really they won't care about being overcharged.
So what do you suggest?
I'm suggesting that people pay for the service that they receive, and therefore they'll be price conscious, and therefore there will be a reduction in healthcare spending.
And that's what I'm saying. That's what I've suggested we're doing.
If a person doesn't have to pay the full price of a service, or doesn't have to pay for it at all, which are the two possibilities, will he shop around and check prices of that service to see where he can get it cheaper?
How do you shop when you have an ulcer? How do you shop when you have a heart attack?
Sometimes it's an emergency, you can't shop. But if it's not an emergency, say you got to have a tooth pulled, you can check. It makes it, if you get a competent dentist in one place and a competent dentist in another, you get the cheaper one, and that keeps a lid on prices. That's how the free market works, right?
Exactly.
So, would the person negotiate price or prioritize relative to other expenses?
Negotiation occurs, and what we're trying to do is to give consumers more power by pooling their resources to negotiate prices. You and I walking into a doctor's office don't have any leverage, but if we pool our resources, as we have done with the Federal Employee Health Benefits Plan, which, by the way, is a very important point. Let me just finish this. All we're doing is giving
what question are you answering?
all we're giving is the same right for the American people to buy insurance that members of Congress have. What members of Congress are able to do is to pool their resources, and then I have the ability.
Yeah, but that's a voluntary program, and there's nothing wrong with having voluntary programs. The objection is that you're going to force this on everybody.
Oh, my employer, the taxpayer, right now is required to pay for my health insurance. They're required to do so. They don't have the option. They're required to do it.
It's part of your salary as a senator, and I'm sure it's well earned. So there's no problem with that. But let me ask you this. Before 1945, was health care spending increasing at a faster rate than general spending?
But 1945? That sounds like a question you've got the answer for. Tell me.
Yeah, well, before 1945, health care spending was increasing at a much slower rate than general spending. In 1945, the Hill-Burton Act was passed, the first major federal health legislation, and all of a sudden, health care spending started to increase at a faster rate than general spending. Then came Medicare and Medicaid, and health care spending started to skyrocket.
You think that has nothing to do with technology or the private sector?
I think it has. Don't you think it has to do with the fact that the government is providing health care programs which are increasing demand, and more people then are spending more because they don't have to worry about price, and they use the services more often because it doesn't cost them the full price of the service?
There was an earthquake in Japan, and we also were in session today. The fact that we were in session had nothing to do with the earthquake in Japan. So
you don't think that, that governmental health care programs increases and is responsible for the skyrocketing cost of health care spending?
Well, opponents of health care reform would have you believe that, but it is a factor, and I admit it's a factor. There is no doubt that all the factors involved with increases in cost have to be looked at. Government participation is a factor. There's no doubt about it. But to say that's the only factor, or to draw that kind of one-for-one relationship is ludicrous.
What kind of, I was going to ask you a question.
I have to go here in just a minute.
Okay, well, let's then do the bottom line because we're running out of time.
Okay.
Let me tell you what I think is the bottom line, and you can respond to it.
Okay.
I would say that the bottom line is that the Clinton and the Mitchell bill would increase unemployment. They would increase taxes, as you admitted that they would increase taxes, and they would increase health care spending while reducing economic prosperity, individual freedom, and choice. And that's the fundamental point, I think, here, choice, because I think that the function of government, the proper function of government, should be to protect individual freedom and not obliterate it. I think that the government simply has no right to force citizens that have not violated anybody's rights to act against their judgment. That was not the system that was created by our founding fathers, nor was it the system that has provided the prosperity that we enjoy today. Our prosperity, I think, is based on respecting everybody's individual rights, especially their right to private property, their property rights, which means a free market where citizens can trade based on mutual consent for mutual self-interest, as they determine it, not as determined by a government bureaucrat. And I would say that to the extent that we deny individuals the freedom to act based on their own judgment, we will have the disasters and the debacles that other fascist or socialist countries have tried when they tried that option. And to the extent that we respect individual freedom, we will have the blessings of prosperity, we will have a great healthcare system, and we will truly be the land of the free and the brave.
Thank you very much.
What's your response, Senator?
I disagree.
Okay, well, thanks for that interview. Thanks for watching.